Yes, yes, yes. Welcome back to Hip Hop Hooray, Black Men Talking Health. I am your MC for this evening. I am Oya Gilbert, and we got a really dope program for you tonight. I'm telling y'all, I got some really fantastic guests in the building with me. I'm going to go around the building, let them introduce themselves as we start this extravaganza of an evening with some of my compadres. And I'm going to start with my brother to the left, Mr. Arthur. Could you please introduce yourself?
Yes, sir. Good evening. My name is Arthur. My name is Arthur. I'm definitely a member of this group. Late in having that occur, and I was diagnosed with multiple myeloma on January 3rd, 2024. At the time of diagnosis, I was 76 years old. I've since had a birthday that makes me 77.
Right. That's good. That's
okay.
Good, Arthur. And we're going to move on down to Thomas. Thomas, what you got for your boy?
Hey man, thank you for having me. Good evening, everybody. My name is Thomas. I was diagnosed with multiple myeloma at the young age of 34 years old. I'm happy to say that this is year 19 for me. That puts me at almost 53 in late August. I'll be there. But I'm happy to be here, man. I'm glad to share my experience with what I've been through for this topic with myeloma.
Okay, that's what's popping. Glad to have you in the building. Thank you for coming. And then last but not least, we got
the white guy. The white guy gets to be last. What's this guy? I don't know.
So listen, I'm gonna just dive right into it and address the elephant in the room. I know this show is Black Men Talking Health, right? So I got Michael here. I got Michael here in the building. Matter of fact, Mike, you introduce yourself, and then I'll give him the disclaimer. Go ahead.
Thanks for that. So my name is Michael. I live right outside of Philadelphia, and in just a few weeks, I'll be a 13-year myeloma survivor. I was diagnosed completely by accident, and I am incredibly grateful to be here today with my wonderful and great friends. So share what we can share.
That's what's up. Listen, Mike, we glad you're here. So like I said, I'm gonna jump straight to it. Mike, he's Caucasian. And I even try to go deep inside his, heritage. Maybe he had, somebody with, centuries ago, but he's just white. You know what I mean?
One drop. One drop rule.
But the point is that it's a great segue into today's topic, which is delayed diagnosis in the Black community. And we brought Mike on because not only is Mike a multiple myeloma patient himself and an advocate for folks with disparities, one of his closest and dearest friends is African American, and he has navigated his myeloma journey alongside him. So if there's anybody, and I'm just gonna go ahead and give him his honorary black card, if there's anybody more qualified right now, I believe, to speak about disparity in multiple myeloma, it's Mike. I'm telling you right now. So that's how we're gonna go. And so
Mike can come to the cookout.
So Mike can come to the cookout. Straight up. I mean, thank you, Tom.
So I am going to bust your guys' chops, though, because I really like Michael and not Mike. But I'll let you slide, I mean.
We understand that, but you're going to have to listen. You come into the Black community, you can't be having all these different requests. You got to come in light. You know what I mean? You got to come in light. But
I have to come in light. Okay.
We can go with Michael.
My best friend, actually my very dearest and closest friend, Tony, is African American, and him and I met 7 years ago at a myeloma conference. And over the years, I have been totally indoctrinated. I'm going to use that word into the Black culture. I have learned so much about how he was raised and how he acts, and even to this day, some of the things that he does. But I think one of the things that we want to focus on today is the simple fact of the misdiagnosis. I think of my diagnosis and how I was done by accident, but yet I was well treated and ready to go. But Tony's was delayed by months and months and months because of misdiagnosis. And it's unfortunately very, very common in the myeloma world, and especially in the Black community. And it's totally tragic and unfortunate, and this shouldn't happen. So
and Michael, That's why when Oya and I talked about who should be on this panel, I quickly suggested you guys. Arthur, because of his knowledge, 76 years old, 77. I'm sorry, Arthur, I ain't gonna take none away from you.
That's right.
77 years of knowledge, but with you, we can get the right perspective from how you was diagnosed, and then transfer that to how everybody else is diagnosed.
Yeah, and that's why I said it was dope that I ain't even really had to write this thing, because we don't do that. We don't do scripted podcast episodes, but it is a great transition into the fact that this particular episode today is about delayed diagnosis in general, but specifically in the multiple myeloma space, and we've all experienced it to some degree. And as Mike indicated, that is what I want to ask the group, and I'm gonna start with Mr. Arthur, is when it comes to delayed diagnosis, share your story on how you got diagnosed, and then
all right,
and then explain to the folks, what you think was some of the cause or some of the things that created that scenario.
Okay, well, I will go for a moment to history, if you don't mind.
Go ahead.
In 2019, I was diagnosed with colon cancer and lung cancer, and that went very quickly. They performed surgery, no medicine, no medicine at all, just the operations. Under treatment for that, I was going for semi-annual and then recently annual checkups to make sure that there had been no reoccurrence, and there haven't been. In particular, the one thing that stood out in all of that was a spot in my back that appeared to be inflamed, but they had no rationale for, and the doctors were not particularly interested in finding out what it might have been.
Right.
They said, well, we'll see what happens. Okay, no problem. It wasn't affecting me. It didn't appear to be affecting my bones. I go through various CAT scans or whatever it's called every time I go to the doctor. But lately, in the latter part of October 2023, it had been observed that I was suffering with an anemia, and they couldn't quite figure out where all of that was coming from. And so the oncologist that I was seeing was a little reticent. We're going to check it out. We'll see what's going on. But my significant other, who is a nurse practitioner by profession, goes with me to all of those appointments.
Okay.
And so she suggested to the oncologist that I was seeing, surgical oncologist, have you thought about maybe doing a hematology oncology, just to see if there's something in the blood system that might be the problem? And he kind of looked at her, and he knows her. He knows she don't BS. She's got the 30-year worth of experience
right,
of dealing with various different kinds of patients in the New York area. That's where her profession was. And so he said, okay. And he arranged for me to have a hematologist bone marrow biopsy up at Duke, Durham. Well, we had it towards the end of the year, and on January 3rd, I received an appointment, and I was told that I had multiple myeloma then. Now, what that leads me to believe that if she wasn't there and advocating based upon our prior experience, because I had no knowledge about this kind of stuff, that time that I spent in the hospital in 2019 with those surgeries was my first real hospitalization with anything significant other than a broken bone in 72 years of living. I'm not a person who's been taking medication all of my life. I don't have a lot of experience with the medical field, but she did. So her advocacy, I think, expedited a proactive attitude on the medical system
Right.
to let's go a little bit further than you might normally for somebody who doesn't have that experience. That's how I got diagnosed.
So when you had the prostate, so when you got diagnosed with prostate and you started treating that, you did treat that, correct? Or have you?
Actually, no. See, the prostate came later after the diagnosis for the myeloma. And as it turned out, they did a biopsy and nothing was found. I just had an elevated PSA.
Okay.
But and I was proactive then because I go to urologists on a regular basis.
So the myeloma.
I know, and
the myeloma
was first.
Okay.
Myeloma was first.
Okay, I got you. I just wanted to make sure. I was wondering about if you had the prostate and then you were in that space of cancer.
No.
Still didn't get the education, but I get it. You had no idea you were healthy. Right.
So from the sequence, it was colon, lung, myeloma, and then the prostate elevated PSA.
Okay, got you.
Yeah.
So that's just crazy. Go ahead, Mike.
I know. So Arthur, that spot that showed up on your spine or your back, they just literally ignored it. I mean, does that?
You get it.
That just.
And you know, it's so crazy. This is something like people don't really know a lot about me. So I have a lump that's sort of in my spine, buttocks area, and I've been, coming to jokers, over and over again, and I've been like, "Yo, what's up with this spot right here?" Oh, one dude said one guy said it was flakes of my spine, like I guess I would say some type of more like a sediment of it's settling and a calcium buildup or something like that. I'm like, wait a minute, hold up. So you trying to say my spine is just disintegrating and it's gathering in this one little spot? That's what you're trying to tell me? Well, sort of. So we done some tests on it, but they won't really look at it because this is what they keep telling me. We don't really want to go in there because if it's like nerves growing through there, then it could cause this. And I'm like, so I'm just supposed to accept that? So to your point, and I don't want to digress because I want everybody get a go around, but like Arthur's point is that, you are already in that space with other issues, with other cancers, and you still didn't get information about multiple myeloma.
Yeah,
and that's
exactly.
That's the part I'm talking. That's the part I want to highlight.
And thanks for your care partner, your significant other, like you like to call it. She was there to push the issue. She was there to say, okay, we're going to do this instead of that, or we're going to do this since you didn't offer this. So I'm glad she was a big part of your diagnosis.
And what's? I'm sorry to cut you off, Arthur. You know what's really interesting, Thomas and Arthur, and what is my best friend, the same exact thing on all his misdiagnosis. If it hadn't been for his care partner, his significant other, right, who was a doctor, insisting on another test,
right,
he would have been missed totally too. Totally.
But we here on this program because of that reason. You just said, here go another eureka moment I just had with all that, is that you just said the two things you say. Your author's black, your friend's black. They had medical people in their lives. What about the quadrillion other jokers that don't have that blessing of having somebody medical in their life that can give them that extra nudge or whatever? That's why it's important for us to listen to this information that we're talking about, because these gentlemen are black and they had that person in their life. And once again, it shows the importance of being educated. Had their advocates or their significant others or care partners didn't know that, we might not even be having this conversation.
It might not just be about educating. The education part of the medical field is basically speaking up about what you're going through, speaking up about what can happen or what should happen, or just ask the right questions. Because like I always say, in the black community, we was always raised to not question the doctor. And Oya, you said that too. You put a towel on your head when you fall, because You don't even know if you have a concussion or not, but they just say, hey, take this cold rag and put it over your head. We just have to get past that stereotype and get to a point where we got to ask the right questions when we go in front of the doctor.
Yeah. So I want to give you a short story, guys, because you all mentioned educating. When I was doing my presentation at a Black Baptist church, back a few months ago, I was politely told not to use the word educate, that it would offend the Black community. that I had to use the word knowledge, that I was spreading knowledge, not education. So just FYI, maybe you guys can help me with that in a minute. But anyhow, the point was, So I'm on the pulpit and I'm giving a spiel about myeloma 101 and basically the symptoms and what to look for. And I'm all done, and I spent like an hour afterwards talking with everybody in the congregation. The minister himself comes up to me after. He says, I've had lower back pain. I've had problems going in the bathroom. I've had this, I've had that. I've been tired. And he didn't know any of those symptoms at all. But he says, I'm going to go get myself checked out. So that knowledge piece is critical at the community level to make a difference in early diagnosis. So he sent me a text, I don't know, a month or two later and said, hey, Michael, I'm perfectly fine, but thank you for that knowledge, because it was something else. But yeah.
Right. But that's the importance of what you just said, Mike, is the importance of, one, meeting people where they at.
Yep.
Tom, I want you to go into, when you was diagnosed, and Arthur, we coming back around because we got a nice little minute before we deep dive. But Thomas, tell, when you was diagnosed, but just so Mike know, that's the importance of the word you just said, the education of, them saying, hey, knowledge opposed to educate. It's those small nuances that are an important piece of, or the component of understanding how to navigate in an underserved community, because that's the vernacular. Those are the mannerisms. There's certain things that just come with it. And to your point, in that community, it might be knowledge. You never know what's going on in that community. They might have, they might have the 5%ers, Islam. It might be that kind of community influencing them. But right down the street, it could be another community that ain't influenced by that, and educate might be fine to them. So I just want to point that out as a little nugget. Like, that is the importance of having people understand that look like us and all that in those communities, because we eliminate that. We don't need to fill in the gap. We can have a whole conversation. You might hear 4 regular words, but we done said a whole bunch of information has just transpired. But
and another example of that, before I tell about my story, is when you talk about clinical trials. We're in a point where it's best to say clinical research studies, to get rid of the trial part.
Yeah.
It goes back to history of everything that happened back in the day when blacks was put on these particular type trials. So like you say, it's all about the vernacular. It's all about how you present the information to everybody so they can understand it more, so it can relate, and then they can absorb it to get a chance to go out and serve their community. So
true. Well, Arthur, you look like you got something on your mind, brother. I see gears turning, and then I'm gonna let Thomas introduce himself. But what you got? Do you have any value? What value do you have to that? Because I know you got value. What value do you want to add to that conversation?
Well, I can't say much more than what's already been said. You got to know your audience, and you got to follow directions. Even us. I mean, like I did something very similar to what Michael did. A guy I know was complaining of some stuff. I shared my experience with finding the myeloma, and I told him, listen, here's the deal. Don't be afraid to go and talk to your doctor. Mm-hmm. Don't be afraid to ask for certain kinds of tests, which may reveal something a little bit deeper. Mm-hmm. And this was a one-on-one with him. As a matter of fact, we talked for about 2 hours on the topic. Wow. And then he got back to me very similar as the pastor did with Michael, to say that it was something else. So we can do it one-on-one. We can do it in an arena, a church such as Michael did, or in a podcast like we're doing here. because each one of us have a different set of experiences and a certain way of expressing, you know. So somebody may be listening, they can identify with you, Oye, versus me, or Michael, or Thomas. So if you have a diversity of experience, then the four of us may reach 40 people. The one of us might only reach 10.
Talk about it. Talk about it.
Yeah.
Thomas,
So I want to go back to the white elephant in the room, by the way. So when I start my speeches, when I start any of my speeches that are in the Black community, I always pull up a picture of Tony and I, so they know while I'm there, because you have to be able to relate to it, because they're like, why is this white dude talking here? Why am I here? And the first thing I bring up is I'm here because of him, you know, and that's how it starts. So
that changes. Once again, it's all about what you just said, perspective.
Perspective, yeah.
I have to gain that trust in the beginning, otherwise nobody
Your
hears
message is lost. Your
message is lost, exactly.
It ain't even gonna be received at all. It ain't even lost.
No.
You just talking.
Not at all.
Yep, you just talking. Tom, please share with my people's your wonderful story.
Yeah, I was experiencing excruciating pain in my scapula. I was on vacation and
hold on now. Hold on, scapula. Like, hold on, brother. Let's bring it user friendly.
Shoulder, collarbone.
Plain language summaries.
Drop it down a few levels.
Collarbone, right?
Drop it down.
Got you. Plain language summaries in my left shoulder.
There you go.
Right? And the pain subsided while I was on vacation, but I got home, I was feeling it once again. So I went straight to my family practice doctor. And the only thing he did was he grabbed my arm. He said, "Does that hurt?" I said, "Yes." He pushed against it. He pulled against it. And every time he touched it, I told him it hurt. He just wrote down in his notes the pain that I was having. He wrote me a prescription for some pain medicine, said that I had bursitis, a form of arthritis in my shoulder, and said come back and see him in a few weeks to see, if anything is better. So I didn't like that. So I went and got a few other tests done from an orthopedic specialist. It took about 6 months for me, the whole process, because of appointments. But long story short, I went to the orthopedic surgeon. He biopsied that area. He saw a tumor there. He did an X-ray and MRI, which is normal protocol. When those results came back, he biopsied that area, sent that off to pathology, came back, said it was a cancerous tumor. And if it wasn't for me being proactive and not accepting that first diagnosis of arthritis, bursitis in my shoulder, who knows how long I would have been before I was diagnosed.
Right. That's crazy. Yeah, this delayed situation in the community, especially since we've gotten heavier and heavier into the advocacy space and encounter more and more people that is disease, as we well know, it affects African Americans. One, we tend to not live very long. It's just all bad news most of the time when it comes to this. But I'm going to come back with the overall question that I'm going to start this whole thing off with. But I want to make sure Mike gets in. We're done with the elephant in the room. You family now. So we don't even have to keep talking about that. You just go ahead, shoot your shot, and basically, please tell us, your story, and then obviously, please, include your friend in there. I know who he is, but I want you to go ahead and tell your story.
Okay, so. I was diagnosed in July of 2011 by accident, and I won't tell you the whole circumstance because we don't have much time. But basically, I got tumbled in a wave, and I hit my neck on the beach, middle of the afternoon. Hurt like hell. Drove home, and said, and the wife looks at me and says, "You don't look so good." I said, "Oh, my neck hurts really, really bad. I kind of got tumbled in a wave." And she says, "Maybe you should go to the doctor." Of course, I did the typical man thing and said, "I'll sleep on it. I'll see what it's like in the morning," because just like you said, that's the way you were taught. It's like, even though I'm white, it's no difference. It was like, man up and be okay.
Yeah.
So the next day it hurt worse. So called my primary, So at noon, he sent me for an X-ray, and at 4 o'clock, he called and said, "Yeah, you really did fracture your neck, your C4, your C5. You want to go to your local emergency room. I already arranged for them to fit you with a collar, and you'll be on your way." So I drive myself there. I get fitted with a collar, and literally they do a CT scan, they do some blood work, and 2 hours later, they're like, "quote unquote," "whatever you've got, we can't handle you here. We got to ship you off to a major medical center." And then off to a major medical center in Philly I went, and the next day after a bone marrow biopsy, they told me I had myeloma, and that's how I fractured my neck. So it was literally crazy. It was like, and I had no symptoms, zip, nada, no fatigue, no bone pain. I had nothing. Wow. Had it not been, I credit my son all the time for begging me to take him to the beach that day. I probably wouldn't be here talking with you guys right now.
Wow.
So, yeah.
Wow. But it goes to show that you being at a major medical center was able to get the right treatment that you needed because of the situations that happened.
Yeah.
You went to ER and they was like, "Hey, we can't do nothing for you, but I'm going to send you here."
Right.
Yeah.
But a lot of blacks don't have that option.
No.
When it comes to being
or
diagnosed and
even
misdiagnosed.
rural folks, even rural folks.
And that's what I mean. Mostly the
upstate
rural,
Pennsylvania, there's no hospitals or anything that they don't have it either. So yeah, very different. And then real quick about my best bud, he got misdiagnosed by about 6 months. Literally, he went through muscle relaxers and physical therapy, and they sent him to all kinds of different places before his back collapsed. And even then, they fitted him with a back brace, and they said, "You know what? You got to go home." And had it not been for his partner at that point to say, "Hey, there's something wrong here. You need to do an MRI or a CT scan or whatever they did," they would have sent him home. He probably would have died. I mean, and that's just crazy that it took that long. At least where I came from, it only took them, a night at the local ER to say, "Hey, there's something wrong here. We don't know what." They had no clue what it was. Trust me, they had no idea. But at least they knew enough to get me somewhere where I could get the treatment I needed.
But Mike, so like Thomas said, you make the beauty of this is the comparison in real time. Is that in your particular situation and those circumstances, it progressed like it ought to progress. Like it ought to should for
like that's how it should happen.
Right. That's how it should
for
everyone.
Yeah.
And then typically, as you listen to our 3 stories, it has not. And I didn't share mine, but it's the same thing. Just been told something else. You got this. Take these pills. Get out. Basically just having no clue. And as we well know, with the disease, foamy urine, the unnatural protein in your urine and your bloodstream, and all those different things, the fatigue, those things are just like high indicators, especially if you're black. Especially it comes with the back pain and those different things. And so, that's important. So I want to go around the round table and ask this question. So we know the experiences we had with the delayed diagnosis and all that. In your own personal experience, what do you see as one of the things, like one of the deterrents in whatever your experience was? What do you think caused that? Was it where you lived at geographically? Was it the fact that the dude was just racist? I mean, let's just keep it 100. Was it some of these doctors don't know what the hell they're not as smart as they think they are. It just, what was that? And I'm gonna start with you, Mr. Arthur, as you give me the Malcolm X deep ponder thought stare. Y'all people probably can't see that just listening, but he's got a deep thought. I don't know if he's trying to draw from Jesus to get the right answer to pull it in.
Oh yeah. The only thing he was missing was the shotgun peeping out the window.
Right. He was a straight Malcolm.
He got the Malcolm X stare going peeping out the blinds with the shotgun in his hand.
But what do you?
But I would not contribute it necessarily to a racist perspective for me.
Okay.
And the reason why I wouldn't is because I didn't sense it.
That's correct.
But I would say that I believe that the doctors themselves, for whatever the reason, had too narrow a focus. Now, and the reason why I would say that is because the surgical oncologist happens to be a hematologist also.
Okay.
So if he discovers that my blood work is not normal and I'm anemic, though he initially is treating me for the surgical piece, the colon, the lung, and they're doing that over a 3-year period of time, and now something else develops. If there's a spot in my lung that appears to be, it shows up on one of the scans, and it's showing up continuously over a 3-year period of time. You know, when do you use your overall experience?
Right.
Now, maybe, and I'm gonna say it, you know, all the doctors, except for the hematologist that gave me the news, were Caucasians. You know, now I'm not one to necessarily put that in the forefront.
I got you.
But you know, I'm in North Carolina.
Yeah, right. Yeah, I mean that says it all. Yeah.
All right, I'm in North Carolina.
Right.
Now I was born here, but I didn't live here. I lived in New York for most of my life, and part of the reason why we chose the area that we are in, Wake County, is because of the medical services. Recognizing that when I moved here at 68, stuff may start to go wrong.
Okay.
Now,
Smart move.
would somebody else have gotten a different encouragement? Probably. You know, I mean, because they say North Carolina is a purple state. That's bullshit. Straight up.
Right.
And it's not blue. So
Right.
you figure out what it is.
Right. I got you.
Facts.
You know?
Yeah, I mean, you know, to your point, I mean, it's just but yeah, I definitely hear where you're coming from, Arthur. It's really important to understand that everybody's journey is individual. The story is individual, and it might be different circumstances that cause it, because we've all faced some sort of delayed something in this process. And I will co-sign with you. In my situation, I'm not going to say that, I'm not going to say the doctor is racist, because I don't believe that. Like you said, I don't feel that energy. So I'm not going to co-sign nothing that ain't really happened. But I will say geographically, because I am in a rural area, that was part of the disparity aspect of it, is older white community. How many black people have you really treated? Like, think about it. You know, can I blame them? You know what I'm saying, Arthur? Y'all hear me? It's difficult to say, but that was part of that delayed thing. But the part I can say is that, you know, if I'm coming to you and explaining to you, hey, I've never been sick before, and all of a sudden I feel like I'm about to die. This ain't anxiety. I'm not making this up. I'm telling you, I don't take pills. I'm not an addict. So why would you think that I'm here to be an addict? I have no historical nothing. I'm not coming to you as an addict. I'm coming to you as somebody that's saying I ain't never been sick before, and this feels like I'm about to die. So, you know, Thomas, what do you think, you know, in your particular situation, was that delayed diagnosis, I guess I would say catalyst or cornerstone?
So with mine, I agree. It wasn't racist. It was the fact that he looked at my physical appearance. You know, prime example. You know, I was huge in, you know, stature. I worked in a prison, so I made sure my body was huge, so I could be the person I need for my job. You know what I'm saying? So
can't be my side working at no prison. Can't be my side working at no prison. I ain't gonna secure nothing. I'm gonna tell you that right now. I ain't secure.
There's a few there that's like you, but you know what I'm saying. But I know how I was, and I know how I wanted to be.
Understood.
You know, so when he saw my physical appearance, that's why I think that he didn't choose to offer any x-rays or MRIs, because I don't see him as somebody with a problem like that.
Right.
You know, he's talking about a problem in his shoulder. So why should I run an X-ray and an MRI? This is the thought that I'm thinking he's thinking, just because of my physical appearance. You know, so that was the hugest part of my misdiagnosis, because he looked at how I looked versus running the appropriate test that he could have. You know, and my thing is, if he would have ran an X-ray, you know, it's just family practice doctor, so I know that's all he could have done. If he'd have done an X-ray, that would have eased me a little bit. You know, just the fact that he ran an X-ray to say, oh, it's nothing there. The X-ray wouldn't show a tumor. It'll just ease my mind that something was that something was ran. But I didn't get that at all. You know, I just got, hey, does that hurt? Yes, that hurts. Take this tramadol and see me in 6 months. I mean, 6 weeks or whatever he said. Whenever you feel better, let me know, and we'll go from there.
Good luck, basically.
Yeah, exactly.
I mean, you should be all right. You know, that's another thing. You know, Mike, I know you had some delay in your diagnosis along with your people as well. Can you elaborate? I know you started the story earlier, but can you elaborate on, how to be diagnosed?
Yeah, I think black or white, guys. I really think it comes down to primary community doctor education in myeloma. You know, let's think. So I go to the emergency room and they give me, an X-ray and they fit me with a collar. But even the doctors at that community hospital had no clue what myeloma was. They didn't know.
I agree.
You know, my immediate primary doctor, right, where I went to for my flu shot and all that stuff, I was his only myeloma patient out of probably 10,000 patients or whatever he had.
Wow.
I mean, and I had to educate him on myeloma.
I've done that before.
He knew nothing about it.
That's
and in Tony's case, my best friend, same thing. His physical therapist didn't know anything about myeloma. His primary, again, didn't know anything about myeloma. And I think that's where some of it falls down. Do I think that there's part of a little racism? Yeah, like if I'm looking at Thomas too, he's a big dude. I understand. Hey, he's probably okay. But I think a lot of it really comes down to those educating doctors that to look for the signs, look for a high protein or for a high calcium or fatigue or the bone pain. I mean, they mimic so many other things, but yet the myeloma is right there. And I think that whole education process of trying to get to the community level would make a big difference in how fast people get diagnosed. Because maybe a doctor might say, well, you know what? Hey, let's run this blood test. And that's all it is. It's a simple blood test. Let's run this blood test, and maybe we can figure it out.
And that's what I was getting ready to say with your situation, Mike. Even if they come in with certain problems or certain ailments, it's simple to say, hey, let's run this blood test.
Yeah.
That's all you got to say to a patient. Right. It don't have to be a SPEP. Right. I just want to let me run some blood work and see what your labs say. Yeah. Because your lab, and explain it to them. Your labs tell a lot about your body, a lot about what you're going through. So I know you're coming in here for shoulder pain, but let's run some blood tests and see where we can go from there.
Yeah.
Just something that's simple.
See, Tom, and that's where I was gonna. That's where I was gonna jump in at, Tom, because if you got a patient coming in there, African American or Caucasian, it doesn't really matter, who's had 2 other diagnoses of cancer with a spot in their back.
Yeah.
Now suffering from anemia.
Right.
When do you look deeper than the obvious?
Right.
Well, we don't see any cancer in the colon. We don't see any cancer in the lung, but something else might be going on, because my significant other, her name is Debbie, has educated me in a whole process of travel of cancer. Like, for instance, we were talking about the prostate. I know this is off topic, but just for a second.
No, it ain't. Kick it.
She was saying, when I got my PSA high elevation, her concern was, well, Now, cancer tends to morph.
Right.
You may start with one thing and end up with something else.
Sure.
And we need to be aware of it. Now, if I was Caucasian and if I was wealthy, and all of those other dynamics of who's going to pay for this process, would those tests have been encouraged without her, a nurse practitioner,
Right.
having to tell a medical doctor what he ought to do? And she's like a little pit bull. Or as Sarah Palin might say, a pit bull with lip makeup.
Hey, fellas, I met her. So yeah, she is a pit bull. Gotcha. With makeup.
But that's what,
Right.
But in today's times, or let me say it, when it comes to our health, we need that. We need that in our life. We need that pit bull. I want to make sure, everyone knows that you have to be an advocate for yourself. And it doesn't matter if your education is a novice or expert level, you still have to advocate because it's your body, and you got to remember that. And nobody's going to be able to know what's going on in your body better than you. You just need to be able to get to the right place, the right space, and share what is wrong with you so they can give you real information and feedback from that. And
in my situation, Henderson, that's where I was living. It's not a rural area, but it's not like a big city area as well. So, family practice doctor. And like you said, the oncologist over there, he sees, even though this is before I even thought about oncology, but an oncologist sees breast cancer, lung cancer, Hodgkin's lymphoma, and probably zero myeloma at that time. They see everything else except myeloma. But being at that small family practice doctor, they don't know anything about anything. So after I was misdiagnosed, the Myeloma Foundation, they have this letter that you could print off and say, hey, I blah, 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 blah. These are some of the tests that you should run when patients come in for these symptoms. Right. And I took it to them. I took it to them and left it on the counter. And I said, you need to let your doctors read this because you guys misdiagnosed me. Word. And I took it to them just like that.
Yeah, that's how you got to, that's how you got to come. One great thing as we lead into the one of the closeout questions is, like the resources out there. You have the International Myeloma Foundation. You do have the myeloma link and for blood cancers in general with the LLS. And there's a ton of other ones out there. I won't give them all shout outs, because we need to get paid, but I'm just messing with everybody. The point is, but I do have a real close connection, as we all do, with those organizations. And it's important to know where your resources are as we share this stuff with you. We are speaking from folks that, we don't bring cats on a program that's just, shooting from the hip. These are gentlemen that have been in this space, they in the advocacy space, they regular people that just got this terrible disease. And we've reached out to these resources. We've done the vetting process. And for those that might not know what that word means, is we done stripped down all the cockamamie, and the people that the information we're given, you'll see it in the links in the episode, will greatly assist you on your myeloma journey. So when you think about our situations and the thousands and the trillions of people out there that might be going on with the delayed process, like, can you explain, just give them one of your, solutions or some advice? And I'm going to take something off the table because it's so easy to say this, be your own advocate, we all say that. I mean, really something that you've seen in your journey that was just not cool, like that needs to change, and that could help somebody, a roadblock. And I'm gonna go the other way. I'm gonna start with Mike. I'll put you on the spot, Mike. We've all faced delayed diagnosis, right? All of us have faced some sort of disparity with it, delayed delayed misdiagnosis. It all leads to the same thing. On that journey, giving the audience member or the person, what is the information or something you can give them that can help, or was a barrier to be sort of something they need to look out for? That's what I'm saying. This is what you need to be looking out for.
I think, you mentioned something a little while ago. You know your body better than anybody else.
Mm-hmm.
And
That's what I was going to say.
and I really think that that's the key. And when you, me, I didn't have a damn symptom at all. I mean, nothing, which is odd. I mean, there are a few of us like that happen, but most people get back pain. They get tired. They get, some sort of symptom along the way. And, you said not to be your self-advocate, but you have to be. You gotta listen to your body, and you literally gotta get your butt to a doctor. I mean, me, same way. I never went to a doctor either, a whole lot. But
that's what I was gonna ask you. I was gonna ask you, were you keeping up on your annuals and things of that nature? Were you doing it? Okay, cool. I love it. That's what I'm talking about. Keep it one.
No. The only thing that I did, and this is a funny story if we could digress for a second, but I took a statin at an early age. My father died of a heart attack at 61, massive heart attack. And after our firstborn, my left arm always hurt, and I was beginning to think I was starting to get a heart attack or something. And here it literally was from carrying the kid in the left arm all the time. So I went to a heart doctor, and he says, it has nothing to do with your kid, with your heart. It's your kid, because you're holding him in your left arm and feeding him. I'm like, oh, okay, that makes sense. But in the meantime, he says you have really bad cholesterol and triglycerides, so we're going to put you on a statin. And that was like 32ish, and that's probably the first time I saw a doctor in years. But going back to, let's talk about after diagnosis if we can for a second. Okay. I think the biggest thing there becomes access to the treatments and affordability. And there's a lot of roadblocks there. And I know that's not our subject today, but maybe that's a subject for another time. But
it is. It's coming.
I think that that's also important to find your way around those roadblocks too, because you can get diagnosed even if it's late, but you still can't get treatment or whatever because you can't get there. And that to me is just as dear to my heart as getting diagnosed. So.
Sweet, I love it. Yeah, you'll be back. Yeah, you'll be back. Unless your black card get pulled, but you be back.
I'll behave, I promise.
Yeah, right.
I'll be late for every meeting.
There you go.
Hey, Thomas, what you think, John?
Even Arthur's laughing at that one. I love it.
So to piggyback on
that was a good one.
So to piggyback on Michael was saying, that was exactly what I would say too. Listen to your body, because we know our body better than anybody. And I tell patients all the time that the ones I talk to and advocate with and for, when it comes to these doctors, they only can go by our physical appearance, our labs, our urine sample, and just the questions that we ask to diagnose us and to give us what medications we should be on. I said, so it's best to know your body and know how these medications affect you, and know how it can lead you into other treatment options. With me, I diagnosed myself 3 times on relapse. So when I relapsed, I let them know I was relapsing. I felt the spot, and I let them know, hey, can you order this test because I feel something there. Right. Did the test. It was exactly where I pinpointed it at. On 3 separate occasions that happened. And that's the simple that's what I go back to saying, I know my body. I can tell a difference between a workout pain or a pain where I need to get something checked out. And on 3 separate occasions, I was able to do that.
That's what's up, man.
We got to talk offline about that, Thomas. I'd like to hear more about that.
Okay.
Yeah, man.
And my contribution to that, because, let me go back 32 years. It was at about the age of 45 in the pursuit of something else, and we won't say what that was. But it was the height of the mind your business. It was the height of the AIDS.
Arthur.
It was the height of the AIDS epidemic. I decided to get a doctor because I felt that I, was not going to get better, at anything. And in order to accomplish what I wanted to accomplish, I was told that I needed to take an AIDS test. That was fine. I've kept a doctor in my life since then. In regards to the myeloma, the reality as I contemplated back, because of the cancers that I had, I took, and Debbie and I have been together now 16 years. And when I go to a new doctor, I take her with me, one, to put them on edge.
Right.
Because they don't know who she is. And I tell them, she is my advocate.
Mm-hmm.
If I don't leave here, direct your questions to her.
That's right.
Yeah.
Okay.
So what I'm trying to say is that if we have people in our lives who perhaps have a better experience or more knowledge, and be inclusive. We don't have to travel this road alone.
Exactly.
It was one of the things that I particularly liked about the meeting where I first met you three. Is that I felt that sense of support. Mm-hmm. And we need to understand, especially as men, we don't have to get in this rugged individual false narrative.
Thank you. Come on now.
That's the quickest way to die.
Mm-hmm. Thank you. Come on. That's right.
All right. Now, I tried every time we went to the doctor, and I told you that since 2019, but specifically since 2020, after the colon operation, that little spot was showing up in my back that nobody was dealing with.
Mm-hmm.
Is that, or could that be a part of this whole notification system? Because I didn't realize the effect of bones until after I got involved in the process.
I got you.
When I go back for my annual in October, I'm going to specifically address that doctor and ask him, what are you now going to assume about that particular situation? Since I now know that it occurs in the spinal system, it occurs in the bonal structure.
Right.
Are you still going to play ignorant? Because if you are, we got some ignorant stuff for you.
Yeah. Nail them, Arthur.
I mean, it's, you see, so we need, and again, I have to thank Debbie, because at the end of the day, seriously, if she hadn't appended this guy, and it was only recently when I was looking through his credentials, I saw that he was a hematologist.
Mm-hmm.
So why are you, if anemia is normally associated with blood?
With myeloma, yeah.
Right. Yeah. So now why don't you make that transference of your prior experience, and for just a second, use your entire set of skills.
Or take hematology off of your name.
Yeah. Right. We will have this discussion in October.
No, that's right. That's right.
Because see, therefore, that's the reason why I said I can't say it was racist per se, but I can certainly say it was short-sightedness on his part. Mm-hmm. He did not come with his full bag. He just bought the stuff that he thought would make me feel good. Right. And then I'm dead. You know what I mean?
Right. But that goes back to him looking at you and saying, "Oh, he's just African-American male coming in with these symptoms, I was going to say comorbidities, but I know I got to digress a little bit.
So don't forget.
With these other diseases that he's already...
There you go.
I love it, Thomas.
Right. And especially old, because I've already lived past my lifespan.
Right.
Exactly. So when he come in and he see that, he was like, I'll just give him the basic package instead of giving him the ultimate package. Yeah.
Right.
Which is crazy.
And it's so many different variables, and Mike, I definitely want to make sure we acknowledge the fact, like, first of all, this podcast it's here to stay. So we're gonna have many more sessions to be educating on, the different things that you discussed, Mike, because it is on the backside of treatment as well. that's a whole nother arena.
Yeah.
A whole nother thing. And I don't want to overload, because you know how this thing is. There's so much information out there, and it can be overwhelming. And especially when you're just dealing with the fact of, when we're talking about delayed diagnosis and misdiagnosis, you early in the game, and it's a lot you're trying to digest, just accepting that you have this cancer. But this is showing proof right here. Conclude my wonderful guest, and I got one last question that I ask all my guests on the fly. But as we conclude this thing, I want people to understand that these gentlemen we all have different lengths of time, and we even have another person that's not even in the same ethnicity. And the point is that we are all still thriving with multiple myeloma. We're not just living regular. And I know it's difficult, and I'll let everyone get a chance to chime in on this feel good moment for real. But the point is that you need to understand that that's the reason for these conversations that we have, is to let everybody know that you can get treatment, you can live with this disease and have a good quality of life, not just regular. You guys can say something real quick on that, on your thoughts on encouraging folks living with this disease.
I'll go first. With me, I like to tell people that it's okay. Actually, it's needed to share your story. Because you never know where someone is in their journey, and it could be something that you can tell them that you've been through that will help them get to the next level, or something that you can tell them that they are relating to. So, like me, I've had 3 transplants, right? Auto and 2 allos. So when someone says, hey, how was your allo transplant? By me telling that I've done that, that opens the open-ended questions, allow them to ask more questions and say, hey, I put them at a peace of mind where I know somebody that went through it. I have somebody that I can question, all because I'm willing to share my story about what I've been through.
Man, that's fly. And just before you move on, just hit them real quick so they know what auto and allo is, because you hit them one time, you jumped over them.
Autologous transplant is one where you use your own cells.
Right.
And an allogeneic transplant is one where you use an outside donor. And I was blessed to have my brother as my donor to go through this journey with me twice.
Man, that's super fly. Man, I'm coming to you, Arthur. What you got?
I'm going to piggyback on what Thomas said about sharing your story. 2 major discoveries, funny as it may sound. The way that I got to meet you through the group online, was I shared and Debbie shared the story with her brother-in-law. Her sister has undergone bone marrow transplants, and I didn't know that she had myeloma, myeloma.
Wow, that close.
And right, and her husband is the one that put me on the site. Wow. Because her sister got a mouth that's glued so tight until you couldn't even get air through that mother. So that's her story, and I'll let her tell her story.
That's on a different podcast.
That's a whole different podcast. Whole different.
But see, I don't believe in that closed mouthness.
Right.
Because I never know who can help me. It's the reason why when I first came into the group, I spoke to you fellas like it is.
Right.
And who did I know there? Nobody.
Exactly.
And who have I actually physically met? Thomas.
Right.
Because we live not too far apart, relatively speaking. And we were at a conference where he was a participant, and I wanted to go and see if I could get information. So it's important that we talk to people and stop zipping our lip, in other words.
I got you.
Because at the end of and then I found out my neighbor about 5 houses down, her mother's 8 years into treatment, taking the same medication that I'm taking.
Wow. Look at that, man. See what I'm saying? We got us men, world. And that's why I got Mike here too, Mike, and I'm gonna let you close this out. That's the importance of what I'm talking about with us men. It don't, it's black men talking health. but I mean, it's men and gentlemen. We got to get this crazy, stinking thinking out of our head, this pride thing, and we don't want to share. Or, it's soft to go to the doctor. Let me tell you what's soft. That dirt, when they put you in it, if you holding with pride, do not let pride stand in the way of prevention. Mike, close it out, man. Close it out.
All right. So I think, I want to go back to something you mentioned a second ago and then tag on what Arthur and Thomas just said. And, we're all thriving. I mean, we're doing really, really well. I mean, years ago, myeloma was not looked at as a real living your life, so to speak. I mean, they gave me, 3 months to live, basically, and then they gave me 3 years, and now it's 13 years later, and I'm kicking butt, and I'm probably in the best shape that I've been in many, many years, and I'm also in a mental space. This is a tough disease.
Right.
I'm in a great mental space right now, and how I got there is telling my story. Thomas and Arthur, I share wherever I possibly can, and I'm gonna get emotional now. But what happens is I think that if I share and I can help one person have a better life, I'm a happy guy, and that's what makes all the difference for me.
Ooh, that was a mic drop moment. I think we all share that passion for that, because you are absolutely correct. We don't do this for cash. We don't do this. We do this because we came into this space and we didn't know, or somebody told us, and we just paying it forward as we should. And that's what we do on Hip Hop Parade. We pay it forward. I want to thank my guests for coming on here. We got my man. I always try to come up with names. We got Arthur on here. We got Tom. We got Michael on here. And, I asked all my guests this before we go. I'm going to start with Arthur, because Mike, you might need a moment. This might catch you off guard, or it might not. When you ready to get yourself hyped up, amped up, geeked up to do something, what is one hip hop song that you listen to?
Well, you should have started somewhere else. I don't listen to hip hop. I'm sorry.
Oh my God, you are off the show today. Hey, this is a show.
I'm a jazz and blues guy.
Okay, all right? I got you. So there's hip hop. There's hip hop mixed with jazz. We got Tribe Called Quest. I'm gonna send you a song from Tribe Called Quest. Tribe Called Quest. This is actually, and the listeners, we're gonna follow you, Arthur. We're gonna put you on black. But I'm gonna send you. I want all.
You snatch my card, bro?
No. You got your card. Yeah, you probably did. Yeah, Mike, you in, Mike. I don't know, man. You out, Arthur. But no, we gonna make a challenge up. I'm gonna challenge my listeners to send me in some dope jazz hip hop mix joints, and we're gonna submit it to all. Thomas, go. What you got, man?
Oh man, I got so many to choose from, man. It all depends on my mindset. It all depends on what I feel like working in the gym that day.
Okay.
Because I have that particular playlist. It all depends.
Give me the one that's guaranteed in rotation. Guaranteed in rotation.
Jeez, man.
I knew it. I love this question. I love it. I'm gonna go to you, Michael. Because
I don't listen to any hip hop, but by all means, send me some.
Okay.
But there's a song out there called "Waiting for Superman."
Lord.
That totally pumps me up. If I'm headed to the gym, it's always on my playlist.
Waiting for Superman. I'm gonna listen to this song. We're gonna figure it out. I'm gonna challenge my team and see if we can take this Waiting for Superman. See what it sounds like.
And multiple artists have done it, but the one I listen to mostly is Daughtry. So
okay. Yeah. Got you.
Yeah.
All right, Thomas, you didn't lose your card too, my dog.
I got it, man. Here it is right here. Rick Ross and Andre 3000, 16.
Woo! Okay. Okay, there you go.
On the playlist. I'm gonna tell you how much is on the playlist. When I'm doing cardio in the gym, right? I'm riding the bike. I'll look around and I tell people, hey, I'm listening to Rick Ross. So every once in a while, you're gonna get a whoop.
Yo. And
Okay.
with that being said, that is to close the show. Thank you for listening to Hip Hop Parade, Black Men Talking Health. And all I want to tell people is peace out and keep 5 West.
Hey, thanks for having
Thank
me,
you.
man.
Thank you.
Great time. Thank you.
That was dope.